Hello, and welcome to my comparative health problems presentation, where I will be looking at the maternal mortality rates of the United States, Ghana, and Spain, and trying to understand how the healthcare systems influence them. So to begin, I would like to talk a little bit about what maternal mortality is. It's the death of a woman during pregnancy, during labor, or soon after delivery. And it's measured by the number of maternal deaths per 100,000 live births. And just like infant mortality, it's a pretty good indicator of how the country is doing in terms of health. So United States, Spain, and Ghana, as you can see, are located in very different parts of the world, which influence the maternal mortality rates, the United States and Spain being the higher socioeconomic countries and Ghana being the lower socioeconomic country. So to begin, here are just some numbers here, which I will go into more in depth later, but to try to understand the bigger picture here, the United States has the world's largest GDP, and it spends the most on health, but still has not so good infant mortality and maternal mortality compared to the other two countries. As you can see here, Ghana has the highest maternal mortality rates, but it has significantly less GDP compared to the other two. And I tried to make this figure to try to understand how GDP is related to maternal mortality rates. So to go specifically, the United States is trending upwards and has significant challenges, specifically regarding racial health disparities and economic health disparities, which influence the maternal mortality rates, with people of color and people of lower socioeconomic status having the highest maternal mortality rates. And as we know, the strengths and weakness, as I talked about before, are related to those disparities. But if you're looking at how much money the US has, we're doing pretty good in that sense. But to try to understand the US healthcare system and its role in maternal mortality, we learned about Medicare, Medicaid, and how expensive healthcare is in the United States. And that significantly brings maternal mortality kind of upwards in terms of health. And moving on to Spain, Spain is trending downwards, which is good news. It doesn't have that many challenges when it comes to maternal mortality rates, but of course they still exist in terms of stigma and support. So to try to understand more about the healthcare system, the Spanish healthcare system goes through universal health coverage. So the government is trying to have more equality in terms of individuals being able to access care. But unfortunately, that comes with its negative side effects of government interference, which is always a problem in terms of countries. So the Spanish healthcare system works with primary healthcare, which is the first responders, the doctors and nurses, specialized healthcare, which is gynecologists, obstetricians. They have public hospitals and private hospitals. So moving on to Ghana, Ghana trends downwards, thankfully. Ghana's maternal mortality rates are really high and they have lots of challenges because of their poor economic status. And they have tons of cultural and societal factors that I will get into later. But Ghana also uses the universal health coverage system, but also has its own healthcare system called the Ghanaian healthcare system. And they're also trying to make healthcare accessible to all the Ghanaian citizens without them having to pay, regardless of socioeconomic status. So Ghanaian healthcare system holds both public and private providers. And these are just some of the main parts of the Ghanaian healthcare system, with government hospitals being kind of at the top there. So if I'm going to compare and contrast the USA and Spain to begin with, those are our higher socioeconomic countries. To try to understand, both of them have access to high quality care, but they have completely different systems, with the US having a more private Medicare, Medicaid based system, and Spain having more of a universal healthcare system where all people have access to healthcare. Moving on to try to compare and contrast maternal mortality in the USA and Ghana. The USA has a lower maternal mortality rates, but both of them have disparities in that sense. And to contrast, there are relatively low and relatively high rates. So moving on to Spain and Ghana, to compare, there's a high awareness of public health. Both of them understand that there is a need to reduce maternal mortality rates, but they also have different systems, with Ghana having their own healthcare system. And to just understand in the broader perspective, the government, culture and society, and healthcare obviously influence maternal mortality rates in all these countries. Health education being a big part of reducing maternal mortality rates. So to just kind of understand what we can do to stop this issue, I think the biggest thing is just reducing disparities and investing in resources, especially in countries like Ghana that do not have access to resources such as these. So to just kind of summarize everything that I just said, the lower socioeconomic country of Ghana compared to the higher socioeconomic countries of the United States and Spain all have different healthcare systems, but we can see that there are many similarities and differences between the two countries, to just kind of understand why maternal mortality rates is still a problem. And it kind of helps us figure out what healthcare systems are working and what healthcare systems are not necessarily working, and what we as a community can do to bridge that gap.